third question I ask you is, how can we live the dream we want to create in an atmosphere of uncertainty due to increased scrutiny by governments? There's an increasing focus on privacy policy in both countries, tax policy, and nonprofit status in the United States. What does this mean? Well, clearly, even as the recession makes donated dollars harder and harder to find and our work more difficult, the performance of the not-for-profit sector is coming under increasing scrutiny. We're holding our own on patient privacy. In the United States, the Office of Civil Rights at the Department of Health and Human Services continues to tell us that complaints about privacy violations are rarely, if ever, tied to fundraising. Rarely, if ever, tied to fundraising. In the latest round they did, there were 22,000 complaints, not one in fundraising. They don't even see the need to track complaints raised relative to philanthropic issues, if there are any. However, an overhaul or a tweaking of HIPAA regulations is looming. It's brought about largely through the movement to computerize medical records. There's great concern that the move to electronic healthcare records, a multi-billion-dollar project funded only in part by the government with federal money, aimed at, again, containing healthcare costs, will expose patients to identity theft, marketing exploitation, and other threats to their personal identity. And yet the last thing fundraisers in our community needs is more restriction on access to patient information or more regulations and reporting requirements as we pursue our business, our healthcare business, fundraising as healthcare business under HIPAA. AHP has been taking some positive steps and working hard in this regard. Earlier this year, we were successful in maintaining the HIPAA regulation language that includes fundraising under the definition of healthcare operations, hospital operations. A couple of last things. What about tax policy and not-for-profit status, particularly on the United States side? These issues are aimed at maximizing government revenues, and they may be seen as the other side of the coin of the cost containment effort, and at least they are clearly by the administration. The tax policy and the not-for-profit status issues are fraught with ambiguity, although their proponents claim they are part and parcel of an overarching endeavor to more objectively measure social outcomes funded by donated dollars. There's uncertainty over the issue of tax deductions. The administration has proposed limits on deductibility of charitable contributions starting in 2010. This has gone through 7 different iterations. Overwhelmingly in Congress and the public, it's not going to happen, but it hasn't come off the table in 6 or 7 iterations as it's moving through. It's sticking right there, and the hope is, I think, on that party's side, that it'll slip through. We'll see. Also, writing in, I love this one, writing in the Commentary magazine this summer, David Billett, an author I've really followed for a while, he characterized the proposal on deductibility as a salvo in what he termed the war on philanthropy. And clearly, we've seen more and more of this happening. We also have addressed issues like community benefit. And Senator Grassley and others are very concerned and upset about this. They don't like the way we've defined it. It's different across the board by many different hospitals. Yet Congress put it out there, and that's exactly what they asked us to do, was to define community benefit related to your local needs, which is what we've done. So, we have a lot to overcome with that, and we also have to deal with our position on community benefit, which I believe very strongly is strengthened the more we embrace transparency of how donated dollars are put to use. We have a definite obligation to our donors for proper accountability through sector-wide standards and through the reporting that we do not only to the public but specifically to our donors who have interest in all this. It is all about our stewardship of the resources they are providing. The problem, of course, lies in deciding how an individual donor, a foundation, a corporation, or a government agency can accurately and adequately measure a not-for-profit hospital's benefit endeavors. That becomes the crux of the issue on this. The changes we're experiencing and those that loom on the horizon in the economy and healthcare delivery and government, donor scrutiny, and the ways and means of philanthropy and fundraising can seem overwhelming.